How does hand-foot-mouth disease spread among children? Have you ever wondered how hand-foot-mouth disease spreads among children? This common viral illness mainly affects kids under 5 years old. It is caused by enteroviruses, especially Coxsackie A16 and enterovirus 71. The disease spreads very easily in places where children are in close contact, like childcare centers, preschools, and homes. The primary way hand-foot-mouth disease spreads is through direct contact with an infected person. When children touch or come close to someone who has the virus, they can catch it. This can happen if they touch saliva, mucus, blister fluid, or feces from an infected child. Sharing toys, cups, or utensils that have been in contact with an infected child's mouth or hands is another way the virus can be transmitted. Additionally, the disease can spread through respiratory droplets. When an infected child coughs or sneezes, tiny droplets are released into the air. Other children can inhale these droplets, leading to infection. Another significant route of transmission is through contaminated surfaces or objects. The virus can survive on surfaces like toys, doorknobs, and tables for several hours. If children touch these surfaces and then put their hands in their mouths, eyes, or noses, they can become infected. Hand-foot-mouth disease is most contagious during the first week of illness. However, the virus may remain in the body 4 weeks after symptoms have disappeared, particularly in the stool. This means children can still spread the virus even after they seem to have recovered. Symptoms usually include fever, sore throat, and a rash with blisters on the hands, feet, and inside the mouth. Most cases are mild and resolve without treatment. However, it is essential to keep children hydrated and comfortable. In rare cases, complications like dehydration or serious infections may occur, so medical advice is crucial if symptoms are severe or if a child is very young. To help reduce the spread of hand-foot-mouth disease, parents and caregivers should encourage frequent hand washing with soap and water, especially after using the toilet, changing diapers, or before eating. Regular cleaning and disinfecting of frequently touched surfaces and objects is also important. Children showing symptoms should stay home from school or childcare until they are no longer contagious. If you have concerns about hand-foot-mouth disease or if your child is showing symptoms, consulting a healthcare professional is always the best course of action. This helps ensure the health and safety of all children and supports the prevention of further spread within communities.